Welcome to another session in the Stroke Education series presented by the staff on the Integrated Stroke Unit at Mackenzie Health. These sessions are meant to provide some information to stroke survivors and their family members. Today's topic is communication abilities after stroke, and specifically we'll be looking at what is aphasia. So in this session, I'm hoping you'll learn how communication abilities can change after a stroke, what is aphasia, and how you can help, some specific strategies for communicating with individuals who have aphasia. Often one of the first things that families say to me when they arrive on the stroke unit with someone who has had communication problems as a result of a stroke is what happened to our conversations. Aphasia is a language disorder caused most often by a stroke. 30% of stroke survivors present with aphasia. Aphasia results from damage to areas of the brain responsible for language production and for language processing. In most individuals, the language production and the language processing areas are found in the left hemisphere of the brain. And the severity of the aphasia directly relates to the size of the brain injury resulting from the stroke. When someone has a stroke in the left hemisphere of their brain, in the language center of their brain, we see that these individuals can have difficulty speaking. And I'm going to speak in a little bit more detail about that in the next few slides to come. But what we need to understand is that the language center of our brain, when it's affected, the problem isn't at the mouth and in actually forming the words or getting the words out. It's in actually retrieving language from a specific area of our brain. And so that's what's been affected. And so when someone has difficulty speaking, we also see often that they have difficulties writing. Again, it's for you and I, if we think about writing, we could probably write with our right hand or our left hand if we needed to. Individuals who have a stroke and have communication problems, it's not about using a pen, it's about retrieving language from a specific area of the brain that has been affected. Similarly, when people have problems, when people have aphasia, the language processing area of the brain, the ability to understand what is being said, is affected. And so when someone is reading, information is coming in through visual channels, and it's still going back to that language processing area of the brain. And so whether we're hearing information or we're seeing information, ultimately it has to be decoded and understood in the same language center. So when we look at difficulties speaking in aphasia, they're always impaired to some degree. What we see is that individuals have word finding problems and they have difficulties in using grammar, in linking words together to form sentences and engage in conversation. I often like to use the analogy of a filing cabinet and a shopping bag to explain the difference, to explain word finding difficulties. And this is a bit of an oversimplified explanation, but through the course of our lifetime as adults who experience the world and develop a language system, we learn things about words. So if we take the word table, for example, we say that word, and the minute we say that, we are able to envision a table. We see something round, square, maybe it's influenced, your picture is influenced by what's in your living room. But you immediately know the properties of that word. Most of you would know how to spell that word, you'd know how many syllables are in that word, and you'd know how to use that word in a sentence. You wouldn't start a sentence with table and use it as an article. You know that where it fits in your use of language. And so not just for the word table, but for almost all the words that you have this system. And the minute someone says something to you, you quickly hear it or read it and go back to that filing cabinet and pull the words out. And when someone has a stroke, the analogy really is that someone has dumped that filing cabinet into a shopping bag. And as they go to either listen for words, sometimes the ability to attach meaning to the word escapes them. But more importantly, as we're speaking here, as someone goes to try to find that word to put it into a sentence, instead of opening a filing cabinet and quickly retrieving it, they're searching. And it's almost like looking up a word in a dictionary when you don't know how to spell it, right? It's hard to find the words. In aphasia, we almost always see difficulty understanding to some degree. And again, it has to do with the meaning that's attached to a word. When we hear a word, it goes through our language processing center, and then it's attached to a label, an object, a person, or an action. And sometimes that ability to attach meaning to what's being said escapes individuals when they've had a stroke in the language processing center of the brain. Other difficulties that are associated with aphasia, in some cases we see people who, following their stroke, are mute. They're unable to get out any speech or even sounds. And sometimes that is related to something that we refer to as apraxia that is often associated with aphasia. It's difficulties in initiating a motor plan, and it has to do with what part of the brain has been affected. We can see, in addition, individuals who have difficulties indicating yes or no. They mean to say yes, but they nod their head no. It has to do with the wiring and what's been affected once the stroke, but what has been affected by the stroke. In addition, we can see people who are stuck. Every time they go to say something, they say the same words. So they might say why, they might say inji binji, they might say one. It's almost like they're stuck in a loop and they can't stop that loop. And that's, again, something that is often seen in aphasia. And of course, the last thing, and it's an interesting phenomenon, is sometimes people can't seem to get the words out, and then when they're angry, they seem to go for a string of swear words, and even when they don't mean to be using those words. And sometimes things that are very emotional or very stored in very deep places come out when we least expect them to. The next series of slides are some conceptual material that is really along the lines of what's being done at the Aphasia Institute here in Toronto. And I want to take a little bit of a switch now and talk a little bit about what happens when an individual has aphasia, not just specifically about the communication or speech difficulties associated with aphasia. What we see is that when someone has aphasia, the language problem masks the individual's competence. In other words, it's hard to recognize an active mind when a language system is impaired. What we know is that individuals with aphasia usually know what is going on. It's just very difficult for them to communicate what they know. Imagine if this was you. Imagine that you're intelligent and yet you can't fully understand what people are saying. You know what you want to say, but yet you can't express your thoughts. You feel like everyone thinks you're stupid, and no one takes the time to discuss important issues with you anymore. And I guess the best way to help you to understand this is to maybe think about what it might be like to get on an airplane and land in a country where you don't speak the language. And you get off the plane. I don't speak Greek, but let's say I took a plane to Greece, got off the plane, and someone was asking me for some information, or I wanted to ask them about getting to the pharmacy. I'm really still the same individual I was before I got on the plane. Just I can't interact with these people because we don't share the same language. We don't interact through the same set of symbols, if you want to think of it that way. And even if they wrote, I wouldn't really be able to understand what they were telling me. So we'd have to rely on some other ways to communicate. So if we understand some of the information that I've presented, we can move on to what is it that you can do. And I think the first thing that we need to understand is that the individual with aphasia needs to be treated in a respectful manner. We need to understand the nature of aphasia, and we need to learn some basic skills and techniques for improving communication with anyone who suffers from aphasia. There are some communication tips that you can use. There's different strategies for helping the individual with aphasia understand or process your message, and then there's some strategies for helping the individual with aphasia get their message out. So overall, the first thing we want to do is speak face-to-face. There's so much information that we get from just looking at someone's face when they're talking to us. We understand the emotions, we understand some of the context by looking at a face. And when we turn around or are not looking at someone, there's a bit of information that's lost. Similarly, in a hospital situation, if Mr. Smith is in room 231 and Mr. Smith has aphasia and someone walks by and asks Mr. Smith, do you want a drink? It's very hard for Mr. Smith to understand that and to respond in any way when he has aphasia. So when we're talking, we want to speak face to face. We want to eliminate the distractions and extraneous noise like the television or the radio or any sidebar conversations that are going on. And we want to be able to acknowledge the individual's frustrations. This is a very, very challenging situation to suddenly go from having speech and being able to engage in a conversation to not being able to make your wants and needs known. So, is your message clear? Speak naturally with normal loudness. There's no reason to yell. Aphasia doesn't affect someone's hearing. Although they may have difficulty processing language, their actual hearing is not affected. Use an adult tone of voice. Use short, simple sentences in your speech. So the if we do this, then kinds of sentences are more challenging for someone who has aphasia to understand. And double negatives, like I'm trying to think of an example of a double negative. I don't know, do you not want to go out is a very hard question for any of us to answer. And when you have communication problems, it's even more so. Use an expressive voice. If it's good news, use a happy voice. If it's something, use your tone of voice to express the meaning of what it is you're trying to convey. As you are talking, use gestures that the individual can easily understand. I want to just take a bit of a minute to talk about gestures. As before I came to this facility, I worked at the Aphasia Institute, and we used to run conversation groups, and often gesture was a very important part of helping individuals understand the conversations that were going around the table. And at that time, my children were young, and I would come home and I would say, oh my goodness, look at the time. You guys better eat up, hurry up, eat up, because we've got to go upstairs. When we get upstairs, you're going to have to wash your face and brush your teeth. And if we have time, we'll read a story before we go to bed. So those are gestures that are quite meaningful, and they help in conveying a message. Whereas if I just use a gesture, something like this, it wouldn't help your understanding of what I was saying. So using gestures to help someone understand, using pictures when they're available, focusing on something one at a time, and sometimes using key words or writing the main idea in large, bold print. So sometimes writing something like, "Are you in pain?" Something like this helps. And I know I said earlier that sometimes people have problems with reading, but when we're saying something and we're writing something and we're using our facial expression and our tone of voice, everything is working on that language center to help that person understand. Getting the message out. How can we help someone who has aphasia to respond? How can we help them to get their message across? Sometimes there's not much we can do. I mean, that's the nature of what's happened as a result of this stroke that's left this person with the aphasia. Sometimes we need to ask yes/no questions, one at a time, giving the individual with aphasia time to respond. For most individuals, especially those who are on the stroke unit here at Mackenzie Health, that's one of the early goals of intervention by speech pathology, is to make sure the individual has a way, either with verbally responding, using a thumbs up and a thumbs down, or pointing to the words yes or no to answer questions. When we ask questions, we have to make sure that someone has a way to respond. So we need to check, do they use the gesture? Do they nod their head? How do they indicate yes and no? Other ways that we can help to get the message out are to ask questions that offer a choice. So someone may actually be able to respond to your question by using your own words. For example, do you want tea or do you want coffee? They might be able to say tea, or they might be able to, if you're offering your hand when you say tea or coffee, they might point to the hand, meaning tea. Do you want to stay in your room or do you want to go outside? Those are what we call closed-ended questions, and we're providing a model. And it's much easier for someone with aphasia to respond to a question like that, as opposed to what do you want or what should we do? Last slide, getting the message out. What can you do to help? Is remember to give the individual with aphasia time to respond. If we're going to ask questions, they need time to respond. And be realistic. Sometimes it just doesn't work, no matter what we try. This aphasia, it makes it very difficult to communicate. I have a line that I always use. I always say to someone when they're trying to communicate something and I just can't get it, I always say, I know you know, I didn't eat my Wheaties. Let me think about it for a sec and I'm going to try again. But we do have to be realistic. It may be challenging for the individual with aphasia to get their message across. Once you think that you have a sense of what the person is trying to say, it's best to summarize. Let me see if I understand what you're trying to tell me. Your wife is coming, you won't be attending therapy. Is that what you're trying to tell me? And see if you can get a reliable yes or no response to confirm that. When someone has aphasia as a result of a stroke, it makes communication hard, and it means that it's work. And sometimes when we're doing work, we need to use tools, right? I think when we think of individuals who have difficulties walking after a stroke, we know that physiotherapy can provide them with a wheelchair or with a walker, and that's a tool that's used to help someone be mobile. But when someone has communication difficulties, when someone has aphasia after a stroke, really the toolbox and the tools are really in our hands. It's not something that we can give the person with aphasia to use. We're kind of their, we're kind of the people who break down the barriers and help with communication. It's up to us to ask good yes/no questions, to provide paper to encourage someone to write, or to point to responses that maybe we've offered, to talk in a easy, natural, relaxed way, to gesture as we're talking to make our message more easily understood, or to encourage the person with aphasia to gesture so we understand them more easily. To write, or to encourage them to write or draw. It's all about communication, and what works for each individual will be different. But I believe that conversations can be restored, and that individuals with aphasia can successfully engage in conversations and get their messages across when they have a trained and patient communication partner. Just going to end with a slide that was coined by the Aphasia Institute, again here in Toronto. The slide says, whoever coined the phrase "silence is golden" didn't have aphasia. And I've posted their phone number and their website, as I feel that they're an excellent resource both for individuals with aphasia and their family members. I want to thank the Aphasia Institute for allowing me to share some of their materials in this presentation, the Canadian Stroke Network, and the Heart and Stroke Foundation of Canada. And I also want to thank you for participating and listening in this session today. Thank you.